Welcome back. Daily show, in with our friends at Associated Physicians Group. You know how many times people stop me, Dr. Green, and go, I've seen you in Dr. Green's office now 4 or 5 times, and those are great interviews. It's great. I mean, people are really connecting with them. Love this. And
there are good interviews.
I always like keeping up with you guys at APG. You guys do great, just really great work. And, you know, now to have you back in the studio, Dr. Green and Dr. Morrison, great to meet you in the studio today. You know, Dr. Green, this is going to be really exciting for the office, for patients, for everyone involved, about this kind of new look for Associated Physicians Group. Where should we kind of start with the transition, if you will?
I think the transition is about expanding and broadening the services that we can provide. Mm-hmm. I'm really happy to have Dr. Morrison join us. Primary care physicians are in short supply right now. Dr. Morrison's been in the field of medicine now for, I'm going to guess, somewhere approaching 30 years,
wow,
counting educational time. He graduated summa cum laude from Washington University.
Wow.
Went to St. Louis U Medical School. He did his family practice training in Indianapolis, where he was chief resident of the program. And after that, I think spent 4 years in the Air Force in Arizona.
Mm-hmm. Nevada.
Nevada.
Okay, in Nevada, thank you. And then he returned to his home eventually in O'Fallon, where he grew up and went to high school, and was practiced there for approximately 20 years, and still has a presence there. Okay, so right now Scott's in our Alton office 2 full days a week, and he's in the O'Fallon office 3 days a week. Associated Physicians does have 4 locations. Our primary focus on primary care is Alton, with Scott building another piece of that practice down in O'Fallon, and we do have an office in Edwardsville as well, and so we'll talk about that. But our main focus, what we'd really like to talk about today is the Alton office, which is kind of the center of our primary care. Associate Physician Groups also has pain management, physical therapy, and offers a variety of other products, but I think we'd like to talk about our growth and transition in Alton.
Absolutely. Well, it's really exciting. I mean, this is going to cover the primary care, model that sets you guys apart now. And, with that being said, a lot of people are kind of used to bouncing. It seems like you go to one place, then you got to go to another office to get labs done. Take us through how this is going to work and how, with this partnership, it really, to me, it seems the word efficient, for patients is what I think comes to mind here. Am I kind of onto something with that?
I think you are onto something. I think the way that we have our location, the ease of use in terms of access into the office, it's not, for most of our patients, it's not an hour drive. It's not a hike across the parking lot. It's not 2 elevators and 3 stairwells in a long hallway.
Yeah.
You basically park and you're in the front office within a few steps. That's a huge convenience for a lot of people. We also do a fair amount of telemedicine. We'll talk about that maybe in a little while. Mm-hmm. And I think the idea is that we'd like to grow the part of a practice was what we call the Enhanced Wellness Program or the Concierge Program, and haven't really been able to do that as much as we like to, simply because we've been recruiting and trying to grow our professional staff.
Yeah.
So now we have 3 nurse practitioners, and Dr. Morrison has joined us, and the community has lost some of the primary care base for a variety of reasons, and so we would hope to be able to step up and provide the needs that are there.
Dr. Morrison, take me through your excitement, in this kind of next chapter here with Associated Physicians Group. What are you looking forward to the most?
I like the smallness of the practice, and that it's not, before I was working at a very big, almost factory-like setting.
Yeah.
And this is much more personal, both with staff and with the patients themselves. And I really like that part of it. Mm-hmm. I also like that we can get everything done at once. We can get labs drawn there. We can get x-rays done. We can do it all in one stop, which I really like.
It's fantastic. Well, and that's really where that one-stop shop concept really comes into play, because I can tell you, the amount of times I had to drive grandma from one office and then go get blood work done here, and then we have to go back. And I always asked her, I said, why do you always plan for a couple hours for these appointments? And she said, you'll find out why. And well, I did. You know, I think going back into this, though, you guys have really built something that covers everything truly under one roof. Can you walk us through the different services? I know we touched on them, but just go through, if you could, just the gauntlet of what's provided within that APG umbrella under that roof.
Okay, let me catch my breath. Okay.
That was a long question.
So I did actually put a couple of notes down to make sure I didn't miss anything here. But basically, with Scott's family practice training and my internal medicine training, it's adult primary care, and we do some adolescent care. We do start at age 14 for those who wish that. Although a lot of people stay with their pediatricians now till they get close to 20. We have a variety of services at a higher level, which include the enhanced wellness program, physical therapy on-site, and pain management on-site. But as far as the primary care team, we've got wellness exams, we've got preventive medicine, we've got urgent care for our established patients.
That's really cool.
Right, okay. And we've got on-site x-ray, we've got on-site lab draws, which Scott mentioned. I really think that we are experts in the delivery of complex guideline-directed medical care for a variety of disease situations. We've got a bone density, bone health program with an on-site dexameter. We have a hormone optimization program that's kind of cutting edge. There are a lot of changes in the medical literature looking at hormone replacement, both for men and women in the last couple of years, that are really turning a big page for us in terms of therapeutic options for both men and women that can make huge differences in terms of quality of life.
Oh, yeah.
And perhaps some other things. We have a skincare program. Our nurse practitioner, Candace, is now available to do biopsies on suspicious skin lesions for skin cancer. We don't take care of skin cancer.
Right.
But that's the first step to decide really whether they need referral and further treatment. We are aggressive with our weight management program with all these new drugs on the market. But that's an area that I think we do a better job because we just don't write the prescription. We focus on the nutritional and the muscle-centric issues that are necessary to maintain muscle and bone health while the weight loss occurs. And so I think as a small group, I think we stay up to date. We provide excellent care, and we try to be on the cutting edge. Our smallness gives an advantage that Scott was talking about. If something happens, we can change it overnight.
Yeah.
It doesn't take 3 committees and a whole year to develop a new direction.
Yeah, and that's, I mean, you hit the follow-up really perfectly because that was the next question is, you know, you have all of this and really what does it do? And that, I mean, sums it up. I mean, the efficiency and also being able to deliver, you know, not just accurate care, but also, you know, being able to change, you know, maybe a care management plan or the way things go, like you said, quickly and not, you know, waiting days to hear back from whatever guidelines are on the prongs of the larger hospital system. That's really fascinating. You know, take me through your nurse practitioners. You have you were talking about your additions. What role do they play in patient care for your office? And can you, and how do they expand access for patients?
Well, the expansion of access involves the ability to care for more people. And I think allows us to create some, let's say, time slots that may allow for same day or next day appointments for urgent care type situations. I would hope and believe that patients would rather come to see somebody that they know, and we already know the medications, we know their allergies, we know something about them. If they come to us for an urgent care problem, I think we can probably just do it in a more timely and appropriate fashion. And
maybe you get a better copay with that too, because they get an office copay instead of an urgent care or ER copay.
Oh,
that's a great point.
Yeah, that's.
Yeah, if the urgent care is owned by a hospital, I believe they charge an emergency code. Right.
Whoa, I didn't realize that.
So they can get better with a much lower copay coming to our office instead of seeing ER or urgent care.
Man, fantastic. And, Dr. Morrison, going into, your role here and just your background, working in like you said, the larger setting, take me through the excitement you have now, because it seems like even though you guys are, not a, huge corporate office, you guys have a lot of the same tests and same systems that are there. Does that excite you a little bit?
I like it quite a bit.
Yeah.
Again, everything's at my fingertips. I can get done what I need done to get it quickly, get the results quickly, which is what's important for turning over. I really like our telehealth consults that we can do here to make sure the patients get the follow-up they need for our labs and x-rays and stuff like that. And we just didn't have that opportunity before. But now, like I said, if I draw labs on Monday, I can call you a day or two later with the results and go over them on the phone without dragging you in to see us, but we can make sure you understand what's going on.
Well, and Dr. Morrison, take me through, if you could, your approach whenever you're working with both patients and the broader care team. What do you like to kind of sum it up as, if you could?
My strength is probably explaining things in education with patients. So I will look through their list of meds they're on, look through their diagnoses, and I'll make sure they understand what's going on and why we're doing things. Yeah. And I make sure that we work as a team, not just me and the staff, but me and the patient and the staff, that we're all one big team working together with the final outcome being their good health.
How long has it been since you've been on the APG team?
About 9 months.
About 9 months. What have you learned within the 9 months, and what have you, what have you gathered just by, meeting the patients and meeting them where they're at? Well,
I like the patients here. It's a little older than I'm used to, and that's all right. I like that. You learn each person's strength, at least in terms of the clinic, and which nurse practitioners or staff are good for certain things. So if I see, say, a hormone problem, I know the best person to see that is Mike. And so we make sure that we get them to the right people. And I know the people because I see them weekly. Yeah. It's not just somebody across town. Exactly. And so it makes it very easy to get what I need done and get the results, and then stay with continuity of care where I know what's going on with the patients.
Well, and going into this too, Dr. Green, as you're shifting your focus towards the enhanced wellness concierge care that has been going on, I think it's really unique for you guys to be able to not only do that, but also strengthen the existing, coverage and the existing atmosphere that's already there for your patients. I don't know if that's something you guys really focused on to make sure of, hey, whenever I start to look at this concierge care and start to transition more, I mean, you really, it seems like, hit a perfect fit here, and we're able to strengthen both at the same time.
Well, I think it's going to work well. Yeah. Some patients ask me, am I slowing down? Mm-hmm. And actually, really, it's interesting because as I try to develop the enhanced wellness program, I'm actually turning it up. I'm reading more, I'm studying more, I'm trying to stay more on track. It allows me, I think, to be even more up to date on what we're doing. And it inspires me to do the best job I possibly can.
1,000%. I wanted to touch on this too. How do patients benefit from having, both traditional, insurance-based care, and then on the flip side of that, having that concierge care available at the same practice?
Well, the concierge care, I think the core of the care that we deliver at a very fundamental level is similar. Yeah. Or it actually should be identical. Mm-hmm. But the concierge care allows me to provide a little more time per visit and more access, and sometimes go into depth on some things that might be cutting edge or something of particularly unique interest to the patient that isn't usually part of the discussion. Yeah. So, for instance, in terms of the access, they have my cell phone, mm-hmm. and then there's a dedicated staff member who has another phone, so they get through a little faster that way. As far as their appointments, their standard appointments are twice as long as the others to make sure we touch on all the bases, including the extras. Yep. And then some of the other services that we might provide. If I send a patient to the emergency room, I always call ahead under these circumstances and talk to the charge nurse and tell them, this is the patient, this is their birth date, this is what they're coming on with, I think they need this. The doctor's welcome to call me back if they think it's necessary. And we've we haven't been able, we didn't do the study. There are studies that show a reduction in urgent care use, but on my own informal count, hardly any of our enhanced wellness patients have had any urgent care visits at all.
Wow.
Because they know they get same day, next day service if they call.
Yeah.
Okay.
Exactly.
Yeah.
Well, and I just think it's it really hits so many boxes, I think, for so many people. And I hope that more and more look into the enhanced wellness care program, because it really is something I think that could better everybody. And I think it really is cool to see, you, Dr. Green, getting so excited about it too. And I'm saying that just as a patient standpoint, but whenever you see your medical provider really investing and really rolling up the sleeves and saying, let's tackle this, it really, I think, creates some momentum within the entire office for your patients too and your staff. That's really cool to see.
I do think there is some cross-contamination there. There's no doubt about it. Yeah.
So, I wanted to ask you about, as we're going into the last part of this conversation, Dr. Morrison, you said you were part of a larger hospital system. What do you think patients are missing the most out of when they maybe have to go that route or they choose to go that route? Compared to speaking, going to an office like your guys's?
I think they lack some of the personal care, or they don't get that because they're more like a cog or just a number as opposed to a patient.
Yep.
So when I come in the morning, I see what patients are coming in. I make sure I look up the records, know what's going on. So when I go to see them, I already know what's going on. I'm not just running the room and flipping through pages trying to figure out what's going on.
Exactly, playing catch up.
So when I walk in the room, I know what the plan is already, and then we'll talk it over, and we work together to come up with that. And I did not have the opportunity to do that to the same extent in the larger group that I do now.
Well, and I just think as we keep this conversation going, if someone's in your care system, it's just like, we'll just use me as an example, and whether or not I need some pain management or I need physical therapy after an incident, what's that process look like if I'm already a patient, and seeing you guys, and now it's time to maybe do some additional work in terms of, like I said, the physical therapy or any of those procedures. What's the process look like through your office to start the quote unquote rehab or rehabilitation or the next step of our care?
Well, it's very straightforward and simple. You come see us, tell us what's going on. We take a look at you, do a good evaluation, and then if it's appropriate, we'll set you up with physical therapy and pain management. Basically, so you can regain function and reduce your pain. That's our goal.
I just love that this is all in one office, though, and it's just distributed that quickly. I think is just it got to be such a welcome sight for patients that come in too, and
there's a certain advantage to the proximity. If I'm not sure if the patient's a candidate for physical therapy, I have personally walked them over to the PT floor.
Wow.
Grab the physical therapist when they have a moment and say, take a look at this elbow here. Do you think we can do anything about this? And that's one thing that I can do that you can't do anywhere else.
Yeah.
And I've also, even this morning, I had a patient who had a really bad shoulder contusion, and I went and I grabbed Taylor Reno, who's one of our pain nurse practitioners, and brought her into the room, and I said, take a look at his shoulder. What do you think we can do to help this? And she has him down for a procedure this afternoon. So
wow.
That's
wow. Sorry, you caught me off guard there for a second. That's incredible.
I mean, the fact that they are literally next door, sometimes you can take the patient over there, bring them over when the patient may need more urgent attention or you're not sure they're appropriate, and figure it out right there.
This is just so cool. And I just think, you hit Dr. Morrison, I think, such a great timing, especially working out at a larger hospital and just being able to have all of that, but not having the numbers system, the take a number and we'll get to you mentality. How do you communicate as a team to make sure nothing falls through the cracks? Because there is a lot that goes on within your office, and I'm sure communication's a big part of why you're able to function as well as you are.
Every Monday at 12:45, except for today, because we're here. Anyway, every Monday at 12:45, the internal medicine team meets via Zoom. So if they're in O'Fallon or Edwardsville or Alton, we have a huddle. And we go through kind of an informal outline of what's going on, and then open the floor. Does anybody have any concerns, add-ons, discoveries, whatever it might be? So at a minimum, once a week, we have something scheduled just to touch base and just to make sure that nothing's getting lost.
Well, and before we start wrapping up here and looking ahead and all of that great stuff, I wanted to ask you about just the flexibility that your office has a little bit more. So if a patient has been going to you guys, but they need to change paths, have you seen the needs for patients evolve over time? Do you just work with them where they're at, just on the given stage in life or whatever we're dealing with? Whenever you're working with patients, maybe it's me, and then 10 years down the line you're going, CJ, I told you to quit drinking those energy drinks, and look where we're at here. How does it evolve, the care plan, and how do the patient's needs meet the needs of the patient as they evolve over time?
Well, I've had patients who I saw in my previous practice who followed me to my current practice.
Oh, that's cool.
And some of them I've been able to address problems I've developed over the year, like, say, knee pain. And we have a really good knee program here at APG, and I've been able to get a dozen or more patients into that program with good relief. So they're seeing benefits just from that. And as people get older, more mature, their needs change in terms of often pre-existing conditions get worse, like blood pressure, just to the nature of the condition, and other things show up, arthritis, things like that. And we look for that. We screen for it regularly, annually, if not more. And so we make sure that we're looking for it and ready to deal with it if we find it.
Looking ahead, where do you see this model of care going in the future?
That's a great question. I think the big gorilla right now is what impact will AI have?
It's true, yeah.
And we're watching that carefully, but AI is making, unfortunately, mistakes from time to time that are significant.
Yeah.
So right now we're not heavy users. There are, they say that medical information doubles every 73 days right now. So the tools that we do use are the ones that scrape the medical literature and present us with a reasonable amount of summaries for us to keep up to date.
Okay.
There's no way that you could read everything yourself.
Yeah.
And I think right now that's the most useful tool right now is for the future. And we have those tools in the room now with the patient.
Wow.
Because they're digital, they're on the laptop, and it's even right. And I think we've gotten past the point that we don't have any, for lack of a better word, pride about this. I don't mind opening up the laptop and saying, I'm going to double check the dose and make sure I give you the right dose. Let's look at that real quick.
Yeah.
And lots of times now they even have printouts. Oh, here's a printout for you on your gout. I'm going to print this out. You'll see it says most of what we talked about today.
Yeah.
Might answer some other questions. So I think information, which Scott mentioned earlier, is important. And I want to highlight that if we have time to explain the why, the patient compliance with our program just explodes.
No, I'm sure it does. I'm 100% sure it does.
If we just said, here, you need this, and walked out the room, that's going to be 50-50.
Right.
If we tell them what's going on, it's going to be 98, 99%.
100%. Okay. Yeah, I completely agree with you on that.
And I think going forward to one thing that we have that some of the larger institutions don't is we're more personal.
Yeah.
And as they push more and more towards technology, that's going to become more impersonal. Yep. And that's what's going to set us apart. Again, it's not going to be some dispassionate computer telling you what's going on. It's Dr. Green and myself sitting down and talking to you, explaining and answering your questions in language you can understand.
Exactly. And really just having that time, like you guys know about, it's just such an important thing. With that being said, what are you guys most excited about as you continue to grow this approach in Alton?
I look to see, again, just expanding our patient base, getting more patients in there. What I like, being a family practitioner, is seeing families, parents, adolescents, cousins, uncle. I've had some cases where there's been 4 generations of family I've been seeing. And I want to see, their parents, their siblings. I like seeing that whole thing because then you know what's going on.
Yeah.
So-and-so has this, their brother may have the same. So I want to see more of that kind of family expansion. And I think the personal care is what needs to be going on.
Dr. Green, what's the best way to get in touch with APG and say, I would love to go to your one-stop shop approach and start my primary care needs here if they haven't yet, and to reach out for more information?
There's a website, and there's a telephone.
I'm quick. Watch this. I'm starting to figure this old job out of mine. This is the website. It's associatedphysicians.com. That's associatedphysicians.com. I know that guy. You can find out more information today.
Right. And there's a chance on the website to enroll in Enhanced Wellness if you want to. There's also, I believe, if you want to be a new patient, there are even the forms to fill out and sign out, the patient information forms that we like to see when you present. And I'm pretty sure to make an appointment, though, you still need to make a phone call to get it. We still do that manually. We haven't put that in the patient's hands yet.
Sounds good. Well, anything else to talk about for right now? I think we covered the whole sheet. I hate to grade us, but that's a 95%, I think.
We're all having fun.
We didn't have as much fun as Mike did the other day, though. We had a good time in the studio with hormone replacement.
I believe that.
We'll take a quick break. More conversations come your way next. Really really encourage you guys to check out this Enhanced Wellness Care program at Dr. Green's office. It's really a lot of great feedback from the people that are a part of it, and just from the ones I've talked to have said, no, it's really worked for me, and I hope it works for you guys too. And also go see Dr. Morrison.
Please.
Welcome to the team.
Thank you.
We'll take a quick break. Daily Show comes back your way. Get over here next.